We continue to work really hard towards making our plans. The National Executive Operations Committee is meeting every day, which is clearly multi-agency, so health is really enjoying the support that we're receiving from them, so that the different ministries and organisations, whether it's from commerce or whether it's from education, policing and so on, can all pull together in order to get our plans and all our ducks in a row. The piece of information that's additional today is that we're sending some samples to CARFA for testing. There are 5 samples that are being sent. We send samples to CARFA on Mondays and Thursdays, which is part of our agreement with CARFA. Clearly they manage samples from across the Caribbean, and it's also an agreement with our courier. 4 of the samples that we're sending to CARFA are from residents with recent travel histories. They have returned from travel and have developed some symptoms, so out of caution, they've been in contact with the Public Health Department, who've asked them to stay in the confines of their own home, and they are complying with very well with the guidance that they're being given. The last sample that we're sending is being sent from Health City, Cayman Islands. This is from a patient who originally had a cardiac event on one of the cruise ships, which was not related at all to any respiratory conditions. I understand there was a pre-existing cardiac issue with this particular person, and he was getting a lot better. But in the course of the recovery, he suffered some complications which are not unusual for this sort of condition. So it's really out of a lot of caution that we're sending this sample to CARFA. We will wait for those results to come back. They tend to take between 5 and 7 days to come back. But I think everybody needs to bear in mind that we will test our index of suspicion is much higher now, as particularly with travellers, because the numbers of countries around the world are growing day by day, as we know. And now, in fact, the majority of countries in the world have cases of COVID. So because of that, we will begin to send a lot more tests. If you look at the United Kingdom, for example, they've tested some 20,000 people. But of those 20,000 people, there are only around 200 that have been positive. So for every 100 tests that you're going to do, you're only going to come back with 1 positive. But we do not wish to make any mistakes. We wish to be on top of the situation. So we are being as cautious as we think is right in order to make sure that we detect anybody that might have COVID and that we contain it as well. We will probably get COVID in Cayman, I have to say. What we're trying to do is to slow the time that it arrives on the island. If we can slow it enough, it could well be that a vaccine arrives soon enough to help us. Additionally, if we are to get a case, and it may well be that the case would actually come in a traveller, if we can put a ring of security around and try to keep that under containment, then we can stop it spreading to the rest of the community. Even if there are 1 or 2 cases, what the public really needs to bear in mind is the more attention we can give to containing the situation, the better chance we have of slowing down the spread and preventing it from going around the country. And that is exactly what all the countries around the world have been doing. Some countries have been really quite effective at it. If you look at some countries which have got millions and millions of people, they have been able to effectively contain it and slow it an awful lot. So that's what we want to do. It's countries that have been caught off guard, like obviously China and then Italy, when they didn't know they had a case, when it spread. So we need to be exceedingly cautious so that we can contain anything that should pop up. Your first line of defense is you. But obviously if you're a more vulnerable individual and maybe you're dependent on others, then you have to rely on those around you. So those are those 2 different categories. But it's in some ways, if someone is more restricted to their home, it's a little bit easier to keep them safe, because you know that the moment you enter the house, the moment you go and have anything to do with that person, wash your hands, keep yourself clean so that you don't give it to the loved one or the person that you're looking after. As far as somebody who's more mobile, who may have a pre-existing cardiovascular disease or a respiratory complaint or cancer, or some of the other things that we know might predispose you to be more symptomatic with COVID, you need to take extra precaution. Keep that 3 foot and 6 foot away from the next person. Avoid totally people with respiratory symptoms, and keep your hands clean at all times. Wash them with soap and water if you don't have access to that. Then with hand sanitizer. They're really, really, really important things. in order to protect yourself. The advice actually that's coming about looking after yourself with regards to concerns about COVID is probably to try and withdraw a little bit from a lot of the information we get flooded with and only go to the trusted sources. Because if you receive if you're bombarded with information all the time, especially if some of it is alarmist or might give you cause for concern and wind you up a little bit, you're actually not helping yourself to try to be calm and try to remember the things we need to do to look after each other. So actually, for your own mental health, looking a little bit less at social media and looking at the trusted resources, things like Government Information Service, but also if you have access to the web, hsa.ky/coronavirus, or equally gov.ky/coronavirus, then those information channels are going to give you information you can trust. And if you have a look at those two websites today, you'll find that they're so much more developed even than they were a week ago. They've got an awful lot of information there. Videos about telling you what to do, educational interviews, lots of frequently asked questions, and so on and so forth. So please have a look at the trusted sites, because if you do that, you'll find that you're calmer and you're better able to face the world every day.